The truth about weight loss surgery, food and other changes to your life. To combat the serious increase in people who are morbidly obese, doctors devised the gastric bypass surgery, with the first of the modern-day versions performed in 1993. However, attempts to find a surgery that could help deal with seriously overweight people started decades before, with the first attempt in the 1950s. In 1954, a jejunal bypass surgery was completed and then submitted to a peer-reviewed journal. A surgeon at the University of Iowa, Edward E. Mason, tried the first gastric bypass surgery in 1967 after noting that patients who lose a large portion of their stomach because of cancer, illness, or injury lost a lot of weight despite the amount of food that they eat. 3 years later, a biliopancreatic diversion was performed in Italy. In 1991, the National Institute of Health approved the Roux-en-Y gastric bypass as a valid approach for the treatment of the seriously obese. In that same year, the FruiTasiaT pouch, another weight loss surgery option, was also approved. In 1994, the lap band system was sold in Europe and was later approved in the US in 2004. Since the time that it was started in the 90s, there have been several celebrities who have had weight loss surgery as well. These celebrities have included Roseanne Barr, comedian actress, had the FruiTasiaT pouch surgery in 1998, Carney Wilson, singer talk show hostess, had gastric bypass surgery in 1999, John Popper, blues musician, had gastric bypass surgery in 2000, Al Roker, weatherman and television personality, had gastric bypass surgery in 2002, Anne Rice, best-selling author, had gastric bypass surgery in 2003, Randy Jackson had the FruiTasiaT pouch surgery, also in 2003, Diego Maradona, former soccer star, had gastric bypass surgery in 2005. The plans and the reality of weight loss surgery. Once you have reached a set level of obesity, usually a body mass index, BMI, of 40 or higher, or have a number of weight-related health problems that are threatening your life, you are eligible for consideration for a number of different weight loss types. However, these are only general guidelines and can be different depending on individual situation and the surgeon's preferences. For instance, a BMI that is 35 may be considered in some cases, particularly in those who have a number of serious health considerations in addition to or because of their weight. In addition to BMI, age and general health will determine eligibility for surgery and the type of surgery that is considered to be most appropriate. The most common of the weight loss surgery types is the Roux-en-Y gastric bypass, which creates a small pouch at the top of the stomach with staples or a plastic band. This small pouch is then connected to the middle portion of the small intestine. In all types of surgeries, the surgeon's goal will be to use the least invasive procedure possible that is faster to perform, minimizes the time spent under anesthesia and therefore the risks, and provides a quicker healing time. Laparoscopic weight loss surgery is the most desirable method. However, there are many times when that option is not the right one and the open method will have to be used instead. After the weight loss surgery, most people can return to normal activities in 3 to 5 weeks, but will be eating only a few ounces at a time, liquids at first, then soft foods. Other changes in food intake will include not being able to drink for 30 minutes before or 30 minutes after each meal, and the need for vitamin and other nutritional supplements to avoid deficiencies in vital nutrients. In addition, simple sugars such as candy, juices, ice cream, condiments, and sodas may be problematic and can lead to dumping syndrome. Dumping syndrome is when food moves too fast through the stomach and intestine and leads to symptoms such as shaking, sweating, dizziness, rapid heart rate, and severe diarrhea. As with all surgeries, there are benefits and risks. Weight loss is immediate, with the patient typically losing around 1/3 of their excess weight in 1 to 4 years after their surgery is completed. Risks include infection, leaking stomach, which can sometimes lead to peritonitis, pulmonary embolism, blood clots in the lung, gallstones, anemia, osteoporosis, iron and vitamin B12 deficiencies, occurs in over 30% of all patients, stoma stenosis, which occurs in 5 to 15% of all cases, ulcers, also occurs in 5 to 15% of all cases, staples may pull loose and the bypassed stomach may enlarge, leading to hiccups and bloating. Because of the threat of gallstones following the surgery, the gallbladder may be removed as part of the gastric bypass surgery. Another option is lap band surgery, which consists of an adjustable gastric band which fits over the top of the stomach, which allows the patient to control feelings of hunger and to feel faster. The benefit of the lap band is that it is fully adjustable via ports that are accessible to the doctor. For those who are most seriously overweight, including those who are considered to be too obese for gastric bypass, another option is used. This surgery, the sleeve gastrectomy, may be used until enough weight is lost to convert to gastric bypass. In some cases, weight loss may be enough that a second surgery is not needed. Supplementing for safety. Making sure that you are getting good nutritional support is important. However, the problem with a number of supplement types is simple: they are just too big to be used for those who have had weight loss surgery. ProfectR, ProsisR, IsoMetricR, and the others from Protica are all protein supplements that give a high amount of digestible protein in a very small size and low calorie count. Each serving has 25 grams of protein with only 100 calories and is less than 3 ounces in size, making them perfect for weight loss surgery patients to maintain their health and weight loss.